Hi everyone, my name is Delilah. I am doing my presentation on thalassemia. Thalassemia is a genetic disease that is inherited by one of your parents. It doesn't have to be both, it can be one or the other. Um, and what happens is it causes your red blood cells to not carry enough hemoglobin, and the decrease in hemoglobin in your red blood cells make you anemic and tired. Um, and so, due to that, um, it's like unable to carry oxygen properly throughout your body because it's not carrying enough hemoglobin. Um, and can make your red blood cells look, because of that, it can make your blood cells look smaller than normal. So in my case, I was diagnosed because my red blood cells look really small under a microscope. And because I was showing sensitivity to coldness and fatigue, it made my doctor do more tests on me. Um, and there's different types of thalassemia. Alpha thalassemia is the more severe out of the two, but they still range in severity because people can be a trait of alpha thalassemia, which is a minor, which means you're a trait, you carry the gene, and you may or may not have symptoms later on in life. And then it goes on to intermedia, which is like mild to moderate symptoms. And then there is a HbH disease, um, that's part of the alpha thalassemia, that they have very severe symptoms. And then alpha thalassemia major is really severe symptoms for newborns, very common in young children, and unfortunately can cause them to have a more high mortality rate because of their age. And then beta thalassemia is a more little less severe version of the alpha thalassemia. And again, it kind of goes down the same line again. Minor, you can be a trait of beta thalassemia and not have symptoms at all, or have symptoms later in life as an adult or young teen. Um, and then it goes into like moderate to mild to moderate, sorry, symptoms, and then beta thalassemia, which also is called Cooley's anemia. You have severe anemic symptoms. And then there's a really rare type of beta thalassemia, causing mild to severe symptoms. Um, and those symptoms can be anemic, like I was saying. You get really cold sensitivity, fatigue, pale skin, dizziness, headaches. Like those are the more mild versions of people who have mild thalassemia. And those that have severe cases, or especially in young children and newborns, they can be jaundice, when they're born, enlarged spleen, loss of appetite, among all of the other mild symptoms like anemia, fatigue, pale skin, dizziness, and headaches. So it can kind of range from all those symptoms, depending on the kind of thalassemia that you have. So getting diagnosed, there's a few different ways you can properly get diagnosed by your provider. My provider immediately did the hemoglobin electrophoresis, which tests for beta thalassemia. I think the reason why she went for that test first was because my symptoms were very mild, and she noticed that my red blood cells were really small. So she tested me for that immediately on top of a regular CBC count, which is a complete blood count, um, and that's what showed the small red blood cells. Um, and then if not, they can also do a reticulocyte count, which measures how much red blood cells you have in your bone marrow and how much it's producing. And then my doctor also tested me for iron deficiency because a normal anemic person will have low iron, which would explain why they are very cold all the time and have anemia. But in my case, I think that was what pushed her even more to get me tested, because I never knew that I had thalassemia in my family. So I had no idea. She kind of just picked it up on my blood work and noticed the abnormality, which was great. That she tested me for iron deficiency as well, just to rule out any possibility that it could just be anemia. But my iron deficiency was normal. Like I didn't have a deficiency. It was like normal level. So it pushed her to for further diagnosis that it was probably thalassemia, as that's the only other explanation that she told me. That would explain why I was having anemic like symptoms and why my red blood cells were so small. Um, and then furthermore, testing for alpha thalassemia is usually like genetic testing that can get done at like a genetic counselor, or even a hematologist. Medical genetics, they can go into further depth on that type of thalassemia. Um, but in young children, um, usually they get diagnosed really like sooner rather than later, because their symptoms are more severe than they are mild. The more I feel like it seems like the more mild symptoms you have, um, the chance you'll find out later in life versus the more severe symptoms you usually have either during your young childhood or right after birth or even during gestation. So thalassemia is manageable. There is two kinds of treatment for people who have moderate to severe symptoms. One of them is blood transfusions. If you're a person who has moderate symptoms, then you could, whether it's beta or alpha thalassemia, usually the major form, you can have blood transfusions the major form, you can have blood transfusions 2 to 3 weeks at a time. And for those who have moderate thalassemia, you could have blood transfusions every 4 months, which is I think more manageable, so you can still have a normal life. Chelation therapy is to remove excess iron in the blood. Unfortunately, a side effect of having blood transfusions common, although it introduces healthy red blood cells into your bloodstream, it also can cause iron overload from getting blood from somewhere else. So getting your iron tested regularly just to make sure that you're not in iron overload is important, and not taking, like iron supplements, or, I think you have to like be careful what kind of foods you eat that have high iron, just so you don't cause yourself to be in iron overload. Um, so chelation therapy is really important while you're doing blood transfusion as well. Um, and the only cure for thalassemia is a stem cell transplant, which they take healthy red blood cells from a donor's bone marrow and inject it into your bloodstream. And it usually takes about a month for those healthy red blood cells to reproduce and um, help you, basically curve thalassemia. Although it is a severe and serious like disease. Um, like I said, you can still live a normal life, but there is ways to prepare for, the worst, is what I say. So children are a huge factor. If you're a person who wants children in their future, it's important to know the kind of thalassemia that you have, whether you just carry the gene. In my case, I'm a trait, I carry the gene. I can pass it on to my children, and they can most likely carry the gene, or they can have there's like a certain percentage that your child could have either the alpha thalassemia, which is really severe, or the more mild version of thalassemia, which is beta. So depending on, whether you're a gene, you carry the gene, or you're full blown, um, whether you have the gene or you have the disease like completely, kind of determines what your offspring will get. Also, if both parents have the gene, then your child has a more likely chance of getting the full-blown disease. So getting tested before you start having a family with your spouse, having your spouse getting tested as well, is really important so that you can kind of prepare for what's to come. And also you can also get tested during your gestation. During pregnancy, they can test the fetus as well for it being a trait. And it just gives you a chance to see the possibilities because of the high mortality rate in children, especially newborns, um, because of the alpha thalassemia. But other than that, you can definitely, get around that and talk to a genetic counselor, and they can get you better answers. And below is just my works cited. Thank you so much for listening.